Good afternoon, everybody. We saved the best for last, and so really happy to have Morgan Evans, who is the National Sales Manager of GPOs with PDC. And what we're going to spend a little bit of time talking about this afternoon is the vital role of accurate information in improving healthcare workflows. And so what we're going to delve into as we have this conversation over the next 15 minutes is the world of patient care workflows, patient identification, medication administration, and specimen collection. We're going to explore the vital role that identification plays in safe and efficient patient care. Our expert, Morgan, is going to guide us and provide us insights on the direct impact that high-quality ID solutions can have on improving workflow efficiency and preventing medical errors. And we're going to explore how focusing on the right solution can save your staff time, frustration, and allow them more time and free them up to spend time on the important thing, which is patient care. So thank you, Morgan, for being with us.
Thank you, Craig, for taking the time.
And so why don't we kick it off with how does identification impact healthcare workflows? And as, or more importantly, why does it matter?
Yeah, it's a great question. So identification plays a vital role in healthcare. Not only does it identify the patient, but it also identifies the medications, the samples, the specimens, and so much more. Barcodes are printed on patient ID wristbands and labels to allow staff to easily access the patient's EMR records. It also allows them to see what the proper treatment plan is. So when you think about identification in that context, it plays a very, very important role in not only the patient experience, but also the staff's workflows. If there is an identification error, however, it can not only cost the hospital a lot of money, but it can also be detrimental to the safety of the patient. The United States healthcare systems spends billions of dollars each year on inaccurate identification, and an individual hospital can spend upwards of millions. It's really important that the printers, scanners, and media being used is not only high quality, but is specific for the healthcare environment as well.
Well, with that critical importance and how relevant it needs to be, what advice would you give to our members that are here and going to listen to this after the fact, that are looking to streamline their healthcare workflows to improve care?
Yeah, so I have two pieces of advice. The first one is to observe your clinical staff. Clinicians are extremely resourceful at finding workarounds to ensure they can provide the best care for their patients. They shouldn't have to worry about printing or scanning errors, and they shouldn't have to reprint a patient ID wristband or label. My advice is to observe what your staff is doing, identify those workarounds, and then work to eliminate those as quickly as possible. The second piece of this is to also observe and dig into what products are being used in your ID workflows. Are your wristbands and labels designed specifically for a healthcare environment? Poor quality products can lead to staff frustrations, medical errors, the list goes on and on. Additionally, I would look at your printers. PDC recommends thermal printers to ensure that you can be more efficient. It helps with cost savings, and it also reduces waste. And then I would also take a look at scanners, right? When's the last time you did a scanner upgrade or even a scanner refresh? Having printing and scanning errors will really disrupt the workflow of the staff, and again, can cost hospitals a lot of money.
Makes a ton of sense. And with that advice, there has to be some kind of best practices that you guys bring to bear when you're bringing your solution to providers. And so what are some of those best practices that they should implement and think about as they consider this patient identification area?
So I don't think we'll have enough time to go through every best practice, but I'll just talk about three. So the first one from a best practice standpoint is I mentioned thermal printers in my last answer, and I would really want to reiterate that implementing thermal printers in your system does really, really help from cost savings, reducing waste, right, that you have to dispose of properly because it's patient information, and then also just overall staff efficiencies. So I would recommend thermal printers, but then I would also recommend most providers already print the barcodes on their wristbands and labels. If you're not doing that, that really allows your staff to quickly and easily access the patient's EMR and their proper treatment plan. Secondly, patient identification. Do not do not underestimate the power that a wristband has on the perception of care that your patient is getting. It is one of the first things they get when they come in the hospital. It's one of the first interactions they have with someone that's working at the hospital. And if the wristband falls off, or there's wrong information on it, or even if it's uncomfortable, you're gonna give that patient the perception that maybe the hospital doesn't know what they're doing, right? And we don't want them to question the care they're gonna get from the staff. So a recent example that we did with Atrium was in the emergency department. Their goal was to reduce door-to-doctor time. How we did this is we brought admissions to the bedside. By doing this, we reduced their door-to-doctor time by 47%. That has a direct impact on the overall patient satisfaction score, right? That's something that's very important to healthcare. And lastly, look at your labels. Everywhere you look, there can be a label, right? There's millions and millions of labels, maybe not millions, millions, but there's a lot of labels, right? That's my point. So we want to ensure that from the label perspective, we're using the right labels for the staff and for the correct application. There's many different adhesives. There's antimicrobial labels, right? We have, PDC has clean room labels, histology labels. We even have HIPAA compliant labels to allow your staff to not have to think when they're applying a label or questioning the work that they're doing. We want them continuously to focus on the patient care and overall experience. So at the end of the day, in my summary for those, is just make sure that you're purchasing high quality products, and the products you're purchasing are designed specifically for a healthcare environment.
Very comprehensive, so I
Thank you.
appreciate that. Hopefully people are taking good notes in terms of what they can learn to improve in this important area. So, at the end of the day, what it really boils down to is, what do you recommend our members should do? People that are sitting here listening to this conversation are like, you know what, there is an opportunity here I haven't really thought about. What can they do to actually advance their initiative around improving workflow through patient identification?
Great question. They can either reach out to myself, me, or our PDC representative. So my recommendation is PDC is hyper-focused on finding the right product and solution to support your workflows and your staff. We recently did the work with Atrium that I mentioned, right? We identified that they wanted to reduce their door-to-doctor time. We created and helped implement a mobile admission cart. This was the way we were able to band patients at the bedside. So, all in all, PDC is your one-stop shop that combines technology with best-in-class hardware and media to ensure you are able to continue to provide best-in-class care for your patients.
Well, I think incredibly efficient in
Thank
terms
you.
of your responses, but I think crystal clear in the value that PDC can bring. Really appreciate you spending time, and I do encourage any of you to take advantage of this really important advancement in terms of how people's experience through the patient journey can be improved through leveraging PDC's capabilities. So thank you, Morgan.
I appreciate you taking your time to spend this interview with us, so thank you so much.